that is one more reason to make sure that we take care of our respiratory health and that of our children, so we don't end up with this issue of mouth breathing. So in order to improve our breathing, we need to breathe out completely. Often we breathe too shallowly. We don't breathe in deeply enough or breathe out completely. We take in a little breath and we also take out little breath. So to actively try to breathe out completely, to exhale fully, and then also to inhale fully. We should, when inhaling, we should breathe in deeply and slowly. And if we are still trying to cultivate this habit, we can even count for as maybe a count of 3 or so, breathing in and then again breathing out, so that we see how to develop that habit, so that we get in the habit of breathing in deeply and breathing out completely. Another thing that can bring problems to do with our breathing is our posture. So for example, now I'm sitting in front of a screen, and what tends to happen is that we slouch over the screen. Maybe sometimes it's that I'm watching TV, and what I might do is slouch in a seat, and what happens when we do this is that we compress our thoracic cavity, that is the chest area, which means that then we are not able to give our lung full capacity in breathing in or breathing out. So good posture is important, and avoiding slumping. This is not only important for our breathing, but it is also important for our skeletal health, particularly of our back and shoulders and necks. Because if you're in the habit of slouching, we can have issues not only to do with shallow breathing, but also to do with back problems. A lot of lower back pain originates actually from slouching and keeping poor body posture. So after posture, we'll also recommend drinking enough water daily. Remember that all these systems that we talk about, the things that happen in them happen in solution, of which water is the most important solvent. Even something like our blood is mainly water, and the gases which we exchange during respiration all are carried in or carried out in solution. So drinking adequate amounts of clean water is important. And then also aerobic exercises a few times a week for about 20 minutes or so should help to challenge our hearts and our lungs, and thus improve their function. So by challenging ourselves by walking briskly, so that we increase the rate of breathing and our heartbeat, will challenge those muscles and organs to function more efficiently. Then the last thing I want to say about breathing is to resolve stress and stressors. Because one of the things that happens when we are under stress, imagine maybe you have gotten some bad news or something has frightened you. The thing that tends to happen is to make our breathing becomes shallow. So we breathe in little and we breathe out little. And so for that reason, to resolve stressors, we often speak about managing stress, but I think in my opinion, the best thing is to try to resolve those stresses, because of course, as we are all aware, we cannot get rid of all the stresses of our life, but we can deal with them in such a way that either they become less stressful and we can accept them as the challenges of our lives, or we can eliminate them where possible. So another source of inefficient breathing will be stressors and unresolved stress. So to do what we can to resolve stressors. If, let's say, we are having a difficult time, we can be more deliberate during stressful periods, to be more deliberate in how we breathe. That is a time to consciously practice deep breathing, and this can even help us to be less stressed, because it forces us to slow down and maybe also to get a handle on our emotions. Then I mentioned that habitual breathing through the mouth impedes healthy breathing, and this is because habitual breathing through the mouth will be the result of maybe blocked noses. Blocked nose can be due to illness. Let's say you have flu or you have got a cold, or it can be due to allergens, which would be causing allergies and inflammation. This can also affect the sinuses, which play an important role. The sinuses are just found just around our nose, within the cheekbones, where they also participate in our respiration. Another thing that can lead to breathing through the mouth will be dental issues. If maybe we have got some tooth problems, either the way our teeth are arranged in our mouth, or if we have dentures that don't fit properly, this can lead to us not being comfortable closing our mouths and breathing through our nose. Swollen tonsils or adenoids are another cause for mouth breathing. And also, if we've got abnormalities in our nasal passages, then it can impede our ability to comfortably breathe through our nose. But as I've said, this is why we have this topic, so that we see which products we can use to help us have a healthy, effective respiratory system. And where an illness is concerned, also to see, maybe to consult a doctor and use our supplements to get rid of illnesses that affect our respiratory system. Then breathing through the mouth is associated with bad breath because, of course, all kinds of bacteria are going, and other microbes are going to get in and proliferate in our mouth. Another thing problem that comes from breathing through the mouth will be, that is, of course, apart from poor breathing, we also will have dry mouth and lips, so the lips might crack and the mouth might feel uncomfortable and dry because the production of saliva when our mouths are open might be reduced, or the saliva might dry out because our mouths are open and the saliva evaporates out of them. This is especially so if we are asleep. Breathing through the mouth also is responsible for a lot of snoring and poor quality sleep, and it can lead to dental problems and also something called sleep apnea. So sleep apnea is something that happens when we are sleeping and our breathing stops during sleep and then starts again. So we have brief moment in which we are not breathing. Of course, this is very dangerous, but also it is going to give us very poor quality sleep. Remember, it is important for us to get not only the minimum of 7 hours of sleep, but also that we should be able to drop into deep sleep. This is not possible if our breathing keeps on stopping, because then we get startled and we wake up and then we have to start sleeping again. So again, that is just to emphasize the importance of breathing through our noses and doing what we need to get out of the habit of breathing through our mouths. Then things that can reduce the effectiveness of our respiratory system will be inflammation of our air passages, as I've mentioned, usually due to illness or allergic reaction. And things like cigarette smoking or being exposed to secondhand smoking from sharing spaces with a cigarette smoker. And then also obesity or overweight can lead to poor body posture and shallowness of breathing, because, for example, if you have an enlarged abdomen, it is going to squish up the thoracic cavity and means that our lungs are not able to open to full capacity when we are breathing. Then, of course, if we are in very high altitude, let's say we are mountain climbers, we should be aware that that can also affect the effectiveness of our breathing, and we prepare adequately if we are going to maybe do some mountain climbing or hiking and so on. So what are the lifestyle points that we can recommend for a healthy respiratory system? The first is to have a healthy diet that is rich in vegetables, some herbs and fruits and so on. This will provide us with some of the phytonutrients that play an important role in the health of our respiratory system. We also recommend that where possible, avoid environmental pollutants and toxins. So habits like smoking should be got rid of. And then also, as far as we are able to participate in detoxing our environment, whether outside our homes or within our homes. And then things, the hygienic points such as cleaning and airing our beddings regularly will help to reduce some of the I don't know if you're aware of things called dust mites. They are small insects that live in mattresses and blankets and so on. So they can contribute to allergies by some of the byproducts that they produce. So by cleaning and airing our beddings regularly, we can minimize issues like that. Then also you can vacuum clean the mattress from time to time, just so as we have got good hygiene around our house. Good ventilation, I already mentioned that, and helping children to learn to breathe habitually through their noses. And also, I think I mentioned aerobic exercises that help our respiratory system. Then on the side of our Neolife supplements, we will recommend supplements that optimize a healthy respiratory system and also helps us to cope with illnesses that affect our respiration. And the first one I want to recommend there is omega-3 salmon oil, which helps in fighting inflammation. This also we can use in hand with omega-3. We can use garlic allium complex. Both of these help in our body to resolve inflammation, which can affect our air passages, causing swelling and irritation. And of course, when our air passages are swollen or irritated, we can have things like sneezing and itching and irritations of these air passages, and even blockage, so that we find that we are not able to breathe well. Then, in addition to omega-3 and garlic allium, we recommend vitamin D, either in its vitamin D, vegan D form, or vitamin A plus D, which also are very important because they help us to recover from respiratory issues. It could be colds and flus and other chronic respiratory illnesses. We do better when we either get sun exposure or we supplement with vitamin D or vitamin A plus D. So if you are in a part of the world where you can get good sun exposure, definitely take advantage whenever you can. But if this is not the case, then you can also supplement with vitamin D. Sometimes it might be that during certain seasons, like in winter, if you're in a temperate area where there's winter comes along, then you may supplement during that time, and then in the warmer months to take advantage of sun exposure. All of this will ensure that we have the advantage of vitamin D or A plus D, which helps us to have a healthy respiratory system, or a resilient one which can recover quickly from flus and colds. Because what we tend to notice is that sometimes you can keep on having these infections and you seem not to be able to get rid of them. This could be because you need to supplement, especially at the beginning of the cold season when respiratory viruses tend to be more common. So take advantage of our supplements and just preempt the beginning of the flu season, as we call it, and start preparing yourself by giving your body what it needs so that it can be resilient. If there are respiratory infections going around, then you'll be able either to not get them or to be able to recover quickly from them, or to get a milder form of the infection. We also recommend, apart from those three, we recommend vitamin C, which is very important for respiratory health, and that is why some of the foodstuffs we recommend in the lifestyle section are rich in vitamin C. So apart from vitamin C, I also like to include their flavonoid complex. Flavonoids also play an important role in our respiratory health. And remember that our flavonoid complex contains some vitamin C in it as well. So you can choose whether you want to use vitamin C, which we have in two forms. You can Sorry, the system kicked me out. So just to go on, for small children, we'll recommend that you can use VitaGuard and Chewable C. And for infants, we can use Liquivite. So all this, as I said, one of the things that I found useful when we had a growing family was just to start the cold season in Southern Africa starts from around May, June. So from around April, we would already start using some things like vitamin C or flavonoids, as well as herbal respiratory and so on, so as to prepare for the onslaught of the respiratory problems that we associate with the cold season, and especially because young children will tend to pick up from their playmates or from school some of these infections quite frequently. So the best thing to do here is to give them supplements so that their immune system is well boosted and able to cope with exposure to such infections. So I see I have a minute or two left, in which case I wanted to mention two questions that I have here. The first one is asthma in a child, what can we recommend? So we recommend, of course, on the lifestyle points, try to identify the triggers for the asthmatic attacks, and where possible, avoid them. Of course, it is not always possible because, for instance, if it is during the place or time when there is a lot of pollen or other such exposures that can be triggering the asthma, then we may or may not be able to get rid of them, but where possible, to minimize or eliminate. Then we recommend VitaGuard. We also recommend omega-3 salmon oil. Since it is a small child, we would say use the omega-3 minis if the child is able to swallow. If they're not able to swallow, I would say that they can chew it. For adults, it's often quite awful, but sometimes children get used to chewing it and don't seem to mind. Otherwise, if they don't like it, you can prick a hole into the omega-3 and squeeze it into their food so that it is combined in there. Then we also recommend for older children who are able to take herbal respiratory complex. If it is a child under 12, we would say to use half of the recommended dose. Then another question was about recurrent pneumonia. Of course, when we get pneumonia involves an infection. So the first recommendation was to consult a doctor so that you get medication, for example, antibiotics, which will deal with the infection. Also to find out why it is a result of reinfection or repeated exposure, or it could be that the person's immune system is weakened. So try to get to investigate a bit why it is that the pneumonia is recurrent. Then recommend from Neolife, we recommend vitamin C or flavonoid complex. I think in this case, especially if the immune system is not so strong, flavonoids will be quite important. And then we'll recommend also omega-3 salmon oil, chelated zinc, and vitamin A plus D. So those would be the recommendations. But remember, my first recommendation is at least in the initial infection, to see a doctor in order to get medication to deal with the infection. And then after that, the supplements can help in recovery and system, the health that it requires to be resilient against an exposure to infections. Okay, so I see that my time has run out. I want to thank you very much for your time. And as we are still in the beginnings of the month of October, I will encourage you to make your goals and have a good plan to work towards them. Sometimes I think as distributors, we would benefit from thinking about our business, because each business is actually unique. Think about your own business and how you can be innovative in coming up with ideas of how to do it, because each of us, we are unique and our situations are unique. So spend some time now and from time to time and think about ways in which you can be innovative in doing your business. And with that, I want to hand you over to Pascal, but also to wish you all the best and to thank you for your time. Okay, here he is. Good